Never do yesterday what should be done tomorrow. If at last you do succeed, never try again. It's never too late to be who you might have been. Pancreatic. Pancreatitis is the redness and swelling, inflammation, of the pancreas. This happens when digestive juices or enzymes attack the pancreas. The pancreas lies behind your stomach on the left side of your belly. It is close to the first part of your small intestine, the duodenum. The pancreas is a gland. The most two powerful warriors of patience and time. Stop holding on to your past, your future might even be worst. Some are living in their future right now, in pancreatic pain. Some have been given days to live on Earth, while some have been told how many days they have remaining on Earth. Dump your past, live in the moments and embrace your future. Whatever comes, comes. Whatever goes, goes. The only antidote to mental suffering is physical pain. Remember, the world is here for you. On the channel biography there is an email address. You can write, film yourself, and share the world your pain anonymously. Pancreatitis is a condition characterized by inflammation of the pancreas. The pancreas is a large organ behind the stomach that produces digestive enzymes and a number of hormones. There are two main types, acute pancreatitis and chronic pancreatitis. Signs and symptoms of pancreatitis include pain in the upper abdomen, nausea and vomiting. The pain often goes into the back and is usually severe. In acute pancreatitis, a fever may occur. Symptoms typically resolve in a few days. In chronic pancreatitis, weight loss, fatty stool, and diarrhea may occur. Complications may include infection, bleeding, diabetes mellitus, or problems with other organs. The two most common causes of acute pancreatitis are a gallstone blocking the common bile duct after the pancreatic duct is joined, and heavy alcohol use. Other causes include direct trauma, certain medications, infections such as mumps, and tumors. Chronic pancreatitis may develop as a result of acute pancreatitis. It is most commonly due to many years of heavy alcohol use. Other causes include high levels of blood fats, high blood calcium, some medications, and certain genetic disorders, such as cystic fibrosis, among others. Smoking increases the risk of both acute and chronic pancreatitis. Diagnosis of acute pancreatitis is based on a threefold increase in the blood of either amylase or lipase. In chronic pancreatitis, these tests may be normal. Medical imaging such as ultrasound and CT scan may also be useful. Acute pancreatitis is usually treated with intravenous fluids, pain medication, and sometimes antibiotics. Typically eating and drinking are disallowed, and a nasogastric tube is placed in the stomach. A procedure known as an endoscopic retrograde cholangiopancreatography, ERCP, may be done to examine the distal common bile duct and remove a gallstone if present. In those with gallstones, the gallbladder is often also removed. In chronic pancreatitis, in addition to the above, temporary feeding through a nasogastric tube may be used to provide adequate nutrition. Long-term dietary changes and pancreatic enzyme replacement may be required. Occasionally, surgery is done to remove parts of the pancreas. Globally, in 2015 about 8.9 million cases of pancreatitis occurred. This resulted in 132,700 deaths, up from 83,000 deaths in 1990. Acute pancreatitis occurs in about 30 per 100,000 people a year. New cases of chronic pancreatitis develop in about 8 per 100,000 people a year and currently affect about 50 per 100,000 people in the United States. It is more common in men than women. Often chronic pancreatitis starts between the ages of 30 and 40 and is rare in children. Acute pancreatitis was first described on autopsy in 1882 while chronic pancreatitis was first described in 1946. Diagnosis of pancreatitis. The differential diagnosis for pancreatitis includes but is not limited to cholecystitis, choledocholitis, perforated peptic ulcer, bowel infarction, small bowel obstruction, hepatitis, and mesenteric ischemia. Diagnosis requires two of the three following criteria. 1. Characteristic acute onset of epigastric or vague abdominal pain that may radiate to the back. 2. Serum amylase or lipase levels 3 times the upper limit of normal. 3. An imaging study with characteristic changes. CT, MRI, abdominal ultrasound or endoscopic ultrasound can be used for diagnosis. Amylase and lipase are two enzymes produced by the pancreas. Elevations in lipase are generally considered a better indicator for pancreatitis as it has greater specificity and has a longer half-life. However, both enzymes can be elevated in other disease states. In chronic pancreatitis, the fecal pancreatic elastase 1, FPE1, test is a marker of exocrine pancreatic function. Additional tests that may be useful in evaluating chronic pancreatitis include hemoglobin A1C, immunoglobulin G4, rheumatoid factor, and antinuclear antibody. For imaging, abdominal ultrasound is convenient, simple, non-invasive, and inexpensive. It is more sensitive and specific for pancreatitis from gallstones than other imaging modalities. However, in 25 to 35% of patients a view of the pancreas can be obstructed by bile gas, making it difficult to evaluate. A contrast-enhanced CT scan is usually performed more than 48 hours after the onset of pain to evaluate for pancreatic necrosis and extrapancreatic fluid as well as predict the severity of the disease. CT scanning earlier can be falsely reassuring. ERCP or an endoscopic ultrasound can also be used if a biliary cause for pancreatitis is suspected. You can't go through life allowing pain to dictate how you behave. I met someone who wants to share the world her pain. Hear from her.
How old were you when you first had your first bout of pancreatitis? I was 26 years old. Hi, my name is Stacy. My story began on April 1st, 2022. I had been experiencing abdominal pain earlier in the week and passed it off as severe, yet unusual, period pain. It wasn't until I was having trouble breathing that my fiancé said it's time to go to the emergency room. The doctors baffled me when they told me I was in the middle of a pancreatic attack with lipase levels in the thousands, 50 times the normal limit. I was prescribed painkillers, referred to see an internal medicine doctor, and was sent on my way. This began my journey of managing my chronic illness. In July 2022, I was suffering from my most severe attack yet, and I spent the 4th of July in bed on clear liquids and pain relief. My pain and inflammation had traveled to other parts of my body, specifically my GI tract. I couldn't eat anything without pain. At this time, I was finally investigated for my ongoing pain and underwent a use in colonoscopy. My results were indicative of pancreatitis, but my scan showed no specific abnormalities. I had my blood immune levels tested and a biopsy taken. This resulted in a negative diagnosis of autoimmune pancreatitis IgG4, and this began a months-long battle on steroids which proved that my negative diagnosis would suggest otherwise. A seronegative case of autoimmune pancreatitis. At that time, I wasn't just struggling physically with my illness, I was struggling mentally too. I was consumed by my thoughts of this illness, what the rest of my life would be like, how I looked on the medication, and the constant battle of with food to put in my body, not knowing what type of pain it would inflict. Unless you or someone you love has a similar condition, you'll never understand how it affects every moment of your life. I've had lots of thoughts and raw emotions accepting this. From not eating at the dinner table, skipping social events because you don't feel like explaining what's happening in your body. And when you do explain, people saying, well, you don't look sick. Feeling shame when you eat a piece of candy. People just watching you eat in general. I felt like a stranger in my own body, scared and not safe. I would have shame and guilt asking to leave work to go to a doctor's appointment. Lied to my friends and family saying I wasn't in pain basically just because I was exhausted. Facing this has been a battle. I never thought I'd say I am sober. Alcohol makes my condition worse and causes detrimental damage to my pancreas. So, I was forced into navigating sobriety at 26, and this alone was life-altering. I thought my life would be over if I couldn't drink. Moments of celebration or joy would never be the same without a glass of bubbly in my hand. But as I began to check off all my sober firsts, concerts, vacations, weddings, I found that is the furthest statement from the truth. It's such a blessing to get to wake up every day. Even better when I have a pain-free day. Things that spark me real joy became so much clearer. The thought of forever seems daunting. So, I just live this part each and every day. There is such little awareness about pancreatitis, no effective treatment, and no cure for this misunderstood and underfunded medical condition. Coming to terms with this is something I'll deal with over time, with the help of therapy. But I have found, healing happens when we surrender to the life unfolding before us and embrace the discomfort. So it's time to embrace it. Tell my story and find the purpose through this pain. That's why I decided to share my story to the National Pancreas Foundation, and in doing so, I had a huge turning point in my health journey. They had shared a story with me of a patient that found out gallbladder sludge was affecting his pancreatitis. Unlike stones, sludge and crystals are not picked up on imaging. After hearing this, I requested a HIDA scan from my care team, which tracks the flow of bile from your liver to your small intestine. I got a HIDA and it showed my gallbladder was functioning at 15%. I ended up getting my gallbladder out a week later. I am recovering well, determined to get seen by a specialist this year and feeling hopeful for the first time in a long time. I am almost a year into a lifelong journey of managing this illness, and I won't ever stop being an advocate for my health. Thank you to my friends and family and my dog Lou, who has been by my side on the good and bad days. Also thanks to everyone who listened to me on this platform and share my story. Goodbye.
Signs and symptoms. The most common symptoms of pancreatitis are severe upper abdominal or left upper quadrant burning pain radiating to the back, nausea, and vomiting that is worse with eating. The physical examination will vary depending on severity and presence of internal bleeding. Blood pressure may be elevated by pain or decreased by dehydration or bleeding. Heart and respiratory rates are often elevated. The abdomen is usually tender but to a lesser degree than the pain itself. As is common in abdominal disease, bowel sounds may be reduced from reflex bowel paralysis. fever or jaundice may be present. Chronic pancreatitis can lead to diabetes or pancreatic cancer. Unexplained weight loss may occur from a lack of pancreatic enzymes hindering digestion. Complications. Early complications include shock, infection, systemic inflammatory response syndrome, low blood calcium, high blood glucose, and dehydration. Blood loss, dehydration, and fluid leaking into the abdominal cavity, ascites, can lead to kidney failure. Respiratory complications are often severe. Pleural effusion is usually present. Shallow breathing from pain can lead to lung collapse. Pancreatic enzymes may attack the lungs, causing inflammation. Severe inflammation can lead to intra-abdominal hypertension and abdominal compartment syndrome, further impairing renal and respiratory function and potentially requiring management with an open abdomen to relieve the pressure. Late complications include recurrent pancreatitis and the development of pancreatic pseudocyst, collections of pancreatic secretions that have been walled off by scar tissue. These may cause pain, become infected, rupture and bleed, block the bile duct and cause jaundice, or migrate around the abdomen. Acute necrotizing pancreatitis can lead to a pancreatic abscess, a collection of pus caused by necrosis, liquefaction, and infection. This happens in approximately 3% of cases, or almost 60% of cases involving more than 2 pseudocysts and gas in the pancreas. Treatment. The treatment of pancreatitis is supportive and depends on severity. Morphine generally is suitable for pain control. There are no clinical studies to suggest that morphine can aggravate or cause pancreatitis or cholecystitis. The treatment for acute pancreatitis will depend on whether the diagnosis is for the mild form of the condition, which causes no complications, or the severe form, which can cause serious complications. Cost of pancreatitis. In adults in the United Kingdom, the estimated average total direct and indirect costs of chronic pancreatitis is roughly £79,000 per person on an annual basis. Acute recurrent pancreatitis and chronic pancreatitis occur infrequently in children, but are associated with high healthcare costs due to substantial disease burden. Globally, the estimated average total cost of treatment for children with these conditions is approximately $40,500 per person a year. In animals, fatty foods may cause canine pancreatitis in dogs. Globally, the incidence of acute pancreatitis is 5 to 35 cases per 100,000 people. The incidence of chronic pancreatitis is 4 to 8 per 100,000, with a prevalence of 26 to 42 cases per 100,000. In 2013, pancreatitis resulted in 123,000 deaths, up from 83,000 deaths in 1990. Medications. There are 7 classes of medications associated with acute pancreatitis. 1. Statins. 2. ACE inhibitors. 3. Oral contraceptives, hormone replacement therapy, HRT. 4. Diuretics. 5. Antiretroviral therapy. 6. Valproic acid. 7. Oral hypoglycemic agents. Mechanisms of these drugs causing pancreatitis are not known exactly, but it is possible that statins have direct toxic effect on the pancreas or through the long-term accumulation of toxic metabolites. Meanwhile, ACE inhibitors cause angioedema of the pancreas through the accumulation of bradykinin. Birth control pills and HRT cause arterial thrombosis of the pancreas through the accumulation of fat, hypertriglyceridemia. Diuretics such as furosemide have a direct toxic effect on the pancreas. Meanwhile, Thiazide cause hypertriglyceridemia and hypercalcemia, where the latter is the risk factor for pancreatic stones. HIV infection itself can cause a person to be more likely to get pancreatitis. Meanwhile, antiretroviral drugs may cause metabolic disturbances such as hyperglycemia and hypercholesterolemia, which predisposes to pancreatitis. Valproic acid may have direct toxic effect on the pancreas. There are various oral hypoglycemic agents that contributes to pancreatitis, including metformin. But glucagon-like peptide 1, GLP-1, is more strongly associated with pancreatitis by promoting inflammation. Atypical antipsychotics such as clozapine, risperidone, and olanzapine can also cause pancreatitis. He who learns must suffer. And even in our sleep pain that cannot forget falls drop by drop upon the heart, and in our own despair, against our will, comes wisdom to us by the awful grace of God. There is no pain so great as the memory of joy in present grief. God always strives together with those who strive. One good thing about music, when it hits you, you feel no pain. Remember, the world is here for you. On the channel biography there's an email address. You can write and share the world your pain anonymously. Thanks for watching. Don't forget to like, subscribe and share. Catch you later.